So I think, well, health screening for children is vital because it can pick up diseases, problems early. The earlier we pick up things, we know that the interventions that we make to treat these conditions are likely to have a better outcome. If we pick things up early, it's more likely that the child is going to go on to have a completely normal, healthy life. Now, routine screening is not typical in the United Kingdom, but it is in other countries around the world, in particular in North America. So we've adapted the American Academy of Paediatric's Bright Futures program for our UK clients, which is basically a screening program at various different time points along a child's life. Starts at birth and goes up to 22 years of age. This is generally a screening program that takes a detailed child and family health history and also involves a detailed physical examination at every visit. And at other certain points along the program, there may be some diagnostic tests, things like hearing tests and also some blood tests to check for things like anemia and lead levels.
That's really interesting. So, for example, if when we're seeing babies in the clinic, the general thing would be to weigh them and assess them and do it quite frequently because they're changing so fast. But as you get older, you don't need to do it so often unless we pick up a problem, when we then intervene. But because the body is changing at a slower rate, it's not necessary to do those tests so frequently. And what I found following this American Academy of Paediatrics periodicity table is that even though they start having annual checkups after a child is 3, sometimes those checkups need to be more frequent during adolescence, because again, that's another time of a huge change to the child and their family. Can you tell me in a little bit more detail what the health screening encompasses in early childhood?
Yeah, so in early childhood, Margarita, the visits are a little bit more frequent, and that makes a lot more sense, as you've already said, because the child is changing so rapidly in early childhood. So it's every few weeks in the first few weeks of life, then every few months, and then goes on to at the age of 3 it becomes a yearly visit. And as we said before, it basically involves a detailed assessment of the child's history and also a physical examination on every visit.
Yeah, I think that's so important because it's so easy to miss things, and there aren't many opportunities for children in this country to get a full detailed physical examination.
Yeah, I mean that's certainly true, and certainly we know that the health visitors will generally look at children in the first part of their infancy. We know that they'll get measured, they'll have their weights checked, but the degree of surveillance tends to drop off as the child gets a little bit older in the United Kingdom. And we also know that the general practitioners are so overwhelmed with work, and with a 10-minute visit it gives them very little opportunity to do a full detailed history and physical examination of a child when you go to see your general practitioner.
I mean, I agree. I think you need at least 45 minutes to get a detailed history and examination. One of the things that I've found parents coming to with their children is with challenging behavioural problems, and this is a very difficult area and so important to help families with. What sort of things have you seen with children with challenging behaviour?
Well, challenging behaviour is a very complex area of childhood development, isn't it, Margarita? So I suppose the best thing to do is just to define what challenging behaviour is, and I suppose the conventional wisdom would suggest that challenging behaviour is any repetitive abnormal behaviour where the child is not compatible with what you would expect for their current age, and where it's actually starting to affect their learning, their development and their education, or it's starting to affect their interrelationships with other people, with other children or with adults. So we have, as part of the screening programme, and at various different time points, screening tools which we can use to look for challenging behaviours. And if we identify that there is a challenging behaviour that needs to be addressed, as we said, early intervention ultimately leads to a better outcome. We would work with colleagues, specialists in child and adolescent mental health, who could help us to diagnose the problem and actually lead to an early intervention. Ultimately, that's going to lead to a better outcome.
Yeah, that's so useful. That's absolutely great. And one more thing I want to say is that sometimes it feels that having regular health assessments throughout a whole child's life, from when they're born to 18 and then really one ought to continue, is so important for our children. And it may seem that some of the tests don't pick up anything, but in my experience and your experience, we are picking up from iron deficiency anemia to children with very thin bones, that it's so important to intervene when you pick up on these things, because you can actually impact on a child's life and the rest of their adult life as well.
Well, that's true, Margarita, and the reality is you don't really know, do you? So it's always best to get a regular checkup to give your child the opportunity to have a really bright future.
Absolutely. Thank you.
Health screening is vital for children, as it can prevent disease and make a significant impact on the health of a child's life. My approach is based on the old maxim that prevention is better than cure, and if a problem can be picked up early, it's generally more amenable to treatment and may have a better outcome. In many countries, including North America, this is standard practice, and we've adopted the American Academy of Paediatrics Bright Futures programme, which involves regular health checks, and have adapted it for our UK clients. We hope to provide our families with peace of mind that the child's had a routine health check regularly and has an established point of contact, so that if a problem arises, they have someone that they can go to for help.
That's an excellent question. I've often thought about when children need to go for a health screening, and as a parent, I've given it, and a doctor, I've given it a lot of thought. It's variable, and for babies, it's actually pretty frequent, as they're changing so quickly, and so many things are happening to their bodies. However, as children get older, visits can be less frequent and can become annual, unless there's a change in between times. We've looked at research by the American Academy of Paediatrics, and they've identified regular time points across the whole of the child's life course when screening is recommended. And that's what we're following, and it's called the periodicity schedule. And this aims to be the most effective way of screening. Not too many appointments, but just enough to be able to pick up things that are going wrong. So if, for example, a baby is not gaining weight appropriately, then this needs to be monitored more carefully. If necessary, investigations can be carried out to make sure there's no underlying problem. If the baby is doing normal development and there aren't any problems, then we wouldn't need to make extra appointments. So the health screening follows, is important, and will follow and aim to pick up the right things at the right time through this periodicity schedule. This varies, it varies what sorts of investigations are necessary for children. There are specific standardized tests that have been investigated by the American Academy of Paediatrics that are appropriate for different ages and according to different children's needs. For example, checking for anemia and vitamin D levels in teenagers. That's something that needs to be done because they're vulnerable, particularly girls. And this is vital for bone growth and good heart function. There are other tests in different children if they're living in areas where, for example, might be worried about lead levels, that we would do those. So we have a standardized investigations that are needed for screening, but we'll target them to what the child's needs are.
Bright Futures Health Screening offers regular consultant paediatrician delivered appointments at various time points during a child's life. It consists of several things: taking a detailed child and family history, doing a complete, thorough physical examination at every visit, And this is very important, and attention needs to be paid to carry out both of these tasks thoroughly. In addition, at certain points along a child's life course, we may do some diagnostic tests, things like audiology, hearing tests, or certain blood tests to just check that everything's within normal limits. In early childhood, this includes testing for normal growth and development of your child. First of all, if your child has behaviour that's unexpected for their age, an excellent first step is to evaluate the child to see if there are any physical or developmental issues contributing to their problems. Beyond that, we have screening tools that we can use to look at the child, the family, and the environment in which they live. If the behaviour is particularly problematic, it needs to be diagnosed and an intervention made to minimise the impact on the child's life and life chances. This would generally be done in collaboration with a child and adolescent mental health specialist and done over time. The Bright Futures programme includes screening, particularly at the time points of 12 and 18 months. Childhood behaviour and its development change over time and is a complex area and depends on many factors. There will be factors within the child themselves, within the family, the relationship between the parents and the child, and the environment in which the family live. So conventional wisdom says that challenging behaviour is any repeated pattern of behaviour that interferes with learning, development, or the interactions between the child and other human beings and in their social interactions. If you think about it, this has the potential to have severe consequences as the child grows, develops, and becomes older. So they need to be addressed, and the interventions need to be made early.
Martin, I'm constantly surprised by what we pick up in screening through health screening in children. Unfortunately, in most cases, there's nothing wrong. What are your thoughts on that? Is it effective to be doing screening where the majority of children that we see don't have anything wrong, have something minor, but there are some that really have problems that we can make a change? What are your thoughts on that?
Well, Margarita, you really never know, and it's much better to get your child checked out, isn't it? Because as we've discussed already, prevention is always better than cure, and ultimately will have a better outcome and give your child the best chance of having a bright future.
I absolutely agree. That makes sense. And in fact, if you think about it, that's what we need to do for ourselves, our families, and any other members of the families, like, I don't know, pets or whatever. Okay, thank you.